Hello, I'm Dr. MANJULA. I'm an IVF consultant at Aansh Hospital, Koramangala, Bangalore, and I also take care of adolescent and menopausal women at my femcare clinic, which is also at Bangalore. I'm continuing with PCO awareness series. Now, PCO, as it's told that it affects the reproductive age group females. It's not just confined to that, according to latest studies and all. The effect it has at different age groups is very different. I'm just giving you further information so that we can break the chain of this epidemic, at least in a future generation. We will let us try to do our bit into it. It's said that those who have poor dietary habits from teenage, even before teenage, that is, taking a lot of junk food, processed food, packed items, those who are having inactivity, sedentary lifestyle, especially you see this adolescent girls when they attend menarche, usually they are in high school or early college days. A lot of stress to perform in the exam. They have sleepless nights. They eat a lot of junk food. They are not having any outdoor activities. If they have this, they are playing something on the mobile, video games and all. All these factors also contribute to onset of PCO. So these girls are more prone to have early onset of menstruation, that is early menarche, and that it is reflected again in the reproductive years. Initial part of the age we just concentrate on correcting the menstruation because they're worried only about it, and that physical change is what happens: excessive weight, excessive acne on the face, the excessive hair fall, or unwanted hair growth on different parts of the body. And then when they come get married and they're planning to conceive, when they don't conceive, they're just bothered about having a baby along with all these features, and then they just get back to the routine, but thinking that after baby is born everything can be corrected, everything comes back to normal. No, it's not that. So it's a myth that PCO gets corrected after delivery. In fact, they have they continue with the problem. They have problems conceiving in the next time also. They feel that after menopause they will get rid of all this. What you have to understand here is PCO is not just menstrual irregularity or not just infertility. It has other disturbances in the body like metabolic syndrome, hyperlipidemia or dyslipidemia, hyperglycemia, hyperinsulinemia, hyperprolactinemia, increased risk of cardiovascular problems, that is having high blood pressure. They are prone to have cardiac problems, MI. Then they can have stroke also, or there's 2 to 8% risk of having endometrial cancer also. Okay, so these things can be reflected even after menopause. Now you see, when you have menopause, there is again hormonal depletion. There in adolescent age, there was hormonal imbalance, your hormonal depletion, but the metabolic changes what PCO has caused is still persisting, and in fact it gets aggravated. Even the person who is normal also, because of the hormonal changes happening in menopause, they're prone for all these metabolic disorders. But since that PCOD and all these were pre-existing, this risk was pre-existing, it gets aggravated. So where is PCO leaving you after menopause? So whatever we tell you during adolescent age to get rid of PCO metabolic changes or the symptoms still has to be followed when you hit menopause to have a smoother life ahead. So you have to think whatever life you spent, around 35 years you have spent in reproductive age. Suppose you have your menstruation at 50 years and you are attaining menopause at 50 years, 15 to 50, 35 years you are in reproductive age group. Similar, 35 years you have to lead your life after menopause if your lifespan is around 85, 90 say, because of the better medical facilities. Think how miserable it is to live with so much comorbidities. Just not living is important. We have to lead a healthier lifestyle. If we're living for such a long time, we should be productive. We should be able to handle ourselves. We're not expecting you to handle your kids or grandchildren as you were burdened during your reproductive age. Handle yourself so that you're not burdening others around you. So it's well said. So always follow these tips what I've told for managing PCO, that is, can manage your diet, exercise, stress, sleep pattern, and excessive exposure to the environmental toxins or use of plastics, all those holds good throughout life. Eat mindfully, stay active and healthy. Thank you. See you soon.